Long hello and welcome to the Glow Up from Health 2024. I'm Nathan C. And today I'm here with Dr. Alan Gee of the Wyoming Health Innovation Living Lab. Did I get it?
You got it.
Excellent.
Perfect. I'm glad to be here.
And Dr. Gee, thank you so much for joining me today.
You're welcome.
I am so excited to talk with you about everything that is on your mind about technology, healthcare, neurology, and more. But before we do that, can you introduce yourself and the work that you do?
I'm Alan Gee. I'm a neurologist. I'm also a neuroscientist. I have a PhD in psychoneuroimmunology from 30 years ago when it wasn't cool. I'm an informaticist by accident. I'm an innovator and practice neurology across Wyoming, as well as innovate technologies.
And so today at the Wyoming Health Innovation Living Lab,
We can just call it WHIL.
WHIL, can you tell me a little bit what your work looks like at WHIL?
Great news yesterday. The WHIL, we've created that to vet technologies. So we work with big companies and small companies to actually operationalize their ideas of the products.
Mm-hmm.
It's co-localized with my clinical neurology practice. So we can work with patients, we can get feedback, and we can help these companies innovate in sprints. And so yesterday, two of the companies that we had the pleasure of working with in the past, both were awarded up and coming companies in the innovation hub here. It was fantastic news. And we also are working on other ways to solve problems.
Yeah. So what sort of problems, what is the problem space that you're working in?
So I'm focused on neurohealth, and I'd love to dive deeper into that. Well, I have many opportunities. So one of the challenges, one of the problems that the Living Lab has addressed is the cost of aging. In Wyoming, in the 2017 aging plan for the state of Wyoming, a state of 568,000 citizens, the cost to care for elderly and long-term care was $139 million, with the projections to triple in 12 years. And so I looked at that as a challenge. It's like, how do we impact that? And as a neurologist, I can know who's going to be in long-term care next year based on how many times they've fallen this year and how many times they've been in the hospital. It's a little too late in life to have a major impact on that trajectory. As I was with my neurologist hat on, if we can maximize or enhance people's cognition and their mobility, they can live independently longer. So the benefit of working in the Living Lab is we have access to really cutting edge technologies globally. And I was able to piece together several different technologies so we can assess people in the community.
What does doing testing in the community at earlier stages look like in the scenarios?
Well, so I was looking at ways that we could assess mobility and cognition.
Mm-hmm.
Right. And so just how you walk, how you move. And so that we were looking at timed up and go, but it's a little hard to do that remotely on your camera, on your computer at home.
Mm-hmm.
So now we're looking at how long it takes to stand up and sit down as an indication of your fall risk, of your mobility, just an assessment.
Mm.
We're looking at speech analytics. And I chose speech and vision because of the complexity of those systems. Touch many parts of the brain.
Mm-hmm.
So if there's a dysfunction in how you produce language, and we can assess that in 45 seconds of conversational speech, pick up problems, perhaps before you know you even have them. Vision system analytics too. There's dozens of ways that we could look at how your vision interacts with the world around you and how you process information. Of those, we chose three. Just so we could look at how we can assess under 15 minutes at home your status, and then you can track it longitudinally. We can see what that trajectory is. And the intent is to engage people years before they're at the doctor's office with a debilitating disease and change their health span trajectory.
I have all these questions about like, how do you go about convincing somebody to change a behavior or a health outcome that's decades in the future?
How do you get people to do anything in their best interest, right?
Okay,
And
sure.
so if you approach it from the psychological behavior modification story, all the things that people have tried, many of them don't work. Certainly seeing a doctor every 3 months for your hypertension and getting a pill doesn't really work. The metabolic syndromes that's so prevalent now, we can talk all day long, we make suggestions. My belief is that we'll be able to engage individuals if we can have contextualized knowledge about their predispositions, about their values, about their culture, about where they live, and then provide them a little bit of contextualized knowledge that we can use to nudge their change in their habits. So it's going to be an ongoing daily touch, if you will. It's a daily practice.
It's hard to get people to do anything. It's really hard to get people to do something in their own best interest. That's a challenge for any technology, any solution. Similarly, you're looking at outcome in the future that have high costs, that have high impacts in quality of life. And it feels like, from a layperson's perspective, that there's a lot of other things that could go in between. How does your work help you understand the signal and the noise in that sort of predictive ecosystem that you mentioned?
Many things to unpack there.
Yeah.
And, the thing that caught my attention was in the future.
Mm-hmm.
I'm not talking about, well, I am talking about the future, talking about changing the health trajectory, talking about preventing or changing the slope of aging and the disease acquisition and progression.
Mm-hmm.
But what I focus on, I call it neurohealth.
No.
And so it's the nervous system. It's not the brain. It's not just mental health. It's not just brain health. It's not women's health or body health or a disease.
Mm.
It's maximizing the human's ability to interact with the world around them, outside and within them. Because what the brain does is it really focuses on survival of the organism. So it's looking for threats that are on the outside. You have your outside sensors, and if something is dangerous or scary, you want to stay away from it. If you have disruption of your physiology, it detects that and tries to correct it. But we only have so much energy to apply to that survival that if you're burning it up on unnecessary things, other systems, your immune system my PhD is in psychoneuroimmunology. Your immune system doesn't function as well. Your GI system doesn't interact with the microbiome and nutrition as well. Reproduction isn't as important. Cognition isn't as important when you're running a fight. And so I like the term neurohealth because it's inclusive. And so it's not just what's happening years down the road in a disease that we might prevent. It's how can we help you live the best life now and be the most productive? And so the foundational drivers of neurohealth, good place to start are quality sleep, good nutrition, regular movement, and the right movement, and mindfulness. And mindfulness isn't just the meditation. It's engaging, it's being in the flow, it's learning new things. It's challenging and building and exercising the brain like we do the body.
I was ready for it to be a big idea, but when you break it down into those core pillars, that feels like what many people are searching for or trying to engage with already, right?
It's the key word is trying.
Yeah.
Right. It's like, even those that know what they need to do, it's hard to do.
Yeah.
It's hard to change that habit.
Mm-hmm.
So again, back to the ability to have those frequent touches and the bits of knowledge and be able to deliver that in a way that will impact their behaviors and habits. I was in a conversation with a gentleman who has great experience in changing society's behaviors. And he pointed out to the crowd that if he wanted me to do something, it had to be attached to my mountain bike. And so if I had to do that one thing before I could ride my mountain bike, I would do it. Everybody's different. And so being able to use technologies now to digitize hormone function, to understand what you're putting in your body, nutrition-wise, what it becomes in your body on the background of your genomics, and then know proteomics, metabolomics, exposomics, as well as culturally what means something to you, what your social determinants of health are, what your personal determinants of health are. When we can manage that data and create authentic information, then machine learning and AI can help us develop insights. When we can manage that amount of authentic information, manage it beyond what the smartest brain, neurologist, physician can assimilate, we're going to see relationships that we've not thought of before that are going to be impactful. And then the end game of the informatics is the performance and how do we use that to change one's outcome or performance.
There's something really specific in the way that you talk about the body systems as almost like inputs and outputs, and something that I process and really conceptualize as a very like fleshy organic thing. I'm hearing you almost see the body as like different channels of data. And there's something very unique about your connection between informatics and body systems.
Yes. Yeah. And, you can't improve what you can't measure. And so looking at ways that we can measure the dynamic nature of that fleshy beast that we call a human, right? And so I'm intrigued by statements that if you take this pill, you do this surgery, it's going to have outcomes. It's like this system is so dynamic. And I was trying to think of ways to visualize that because what the background physiology is at any particular point in time will influence how that body reacts to recovery from the surgery or from the reaction to that pill. And I'm not sure it's the best visualization when I'm working with it, is, taking a cold frying pan and cracking an egg into it. Looks a lot different than when you crack an egg into a hot pan.
Hmm.
And so the environment that we're putting food into or interacting with the environment is influenced by that background physiology. And if we don't take that into consideration, if we can't understand that, our drug discovery, many interventions are going to have mixed results, and one size does not fit everybody.
I wonder if we can get specific just a little bit. You talked about a couple of your technology partners and some of the work that you've been doing. Are you able to talk about like a technology or a test or a way that you've partnered at WHIL to learn more about?
So I'm pretty excited about the product Zyliant
Hmm.
for resilient aging. And this is the conglomeration of some technologies to, again, assess and identify those that are on a steeper trajectory of decline in the wild, if you will. And so we make it available through health fairs to primary care, directly to the consumers, so they can understand what their risk look like. And so while one of the partners is Canary, and doing the speech analytics. And as I understand, 2,500 different markers of how we produce language that we can analyze. Of those, I think there's 13 that are relevant for Alzheimer's, which we could pick that up early. Proxy Vision is another partner that's is, ways to digitize the vision system. So it's not just eye movements. It's not just visual acuity. It's how well we can track objects, how well we can coordinate the movements of the eyes, how we can understand what we're looking at, how we can respond to what we're looking at. And so while we have a dozen different ways we can analyze the vision in 2D and 3D, I've chosen just 3 basic screens to include in the Zyliant product. Working on a decentralized digital data solution that puts people in control of their data. So to give consent. We can audit the consent. We can audit the use of that data. We can tokenize the use of their data. And so thinking of how do you get people to trust doing a neurofunctional assessment? People are like really shy. It's like, I don't want my employer to know that I can't think as clearly as I did 20 years ago.
Maybe not even employer, maybe even family.
Insurance. And so if we can track who uses that data with their consent, I think it gives them a level of confidence to be willing to participate and to do the assessments. Then the other aspect is if we use their data and there's value there, we could tokenize them for sharing. I mean, part of that's ecosystem. And so another enticing feature perhaps of being part of the bigger picture.
I love, I'm hearing tokens. So I'm thinking blockchain. I love that there's this mix of like very straightforward biomarkers and like, using optical testing to understand people's cognitive abilities and then putting those relatively like lo-fi seeming signals into these very powerful processing tools, kind of using the latest and greatest of different knowledge technologies, ownership technologies, so that you can do all those tests around anonymizing, leveraging, studying, processing. So from the health conference, the theme this year is to be bold. What's one way that you would like to see the healthcare industry be bolder in the next year?
So I'm really pushing the personalized precision neurohealth. I want to change the narrative on the interaction of the body with the world around us. Take away the stigma of mental health, focus on what it is, and that's neurohealth and the neurophysiology and how that can impact the health and wellness and changing the health span trajectory. And as far as the bold move is being able to embrace disruption. Putting lipstick on a pig doesn't work.
So what's your approach to building trust into the projects that you're doing at WHIL?
Well, it's finding the right partners to work with. And good people, good ideas, good products, good engineers. And so is the signal that we're capturing, and again, I'm speaking in informatics language now. Are we capturing the signal that they believe that we're capturing? Okay. And then it's how do we protect that data and how do we contextualize it? And I'm still looking at ways that we can use computers and algorithms to contextualize this trusted and authentic information we're creating. I think we're going to see insights that we haven't dreamed of as physicians and how it can affect our health span.
Amazing. So just wrapping up, Who are you looking to connect with, and how can people find you and the work that you're doing?
Always looking for collaborators, always looking for innovative technologies worldwide. If it makes sense, if we can operationalize it, if it can change the insight on function. Also looking at people that still want to invest in those disruptive technologies and viewing the world and healthcare delivery in a different way, and being aren't afraid to jump in, participate, help build companies, help deliver products and solutions to everybody.
Amazing. What a great call to action. Dr. Allengate, it has been so great to talk with you today on the Glow Up from Health. Thank you so much for the work that you do.
My pleasure to be here. Thank you so much for the invitation.